Hello, I'm Dima Zainuddin, clinical pharmacist working in Kim's Health Hospital, Sultanate of Oman. My poster title is Proton Pump Inhibitor Stewardship, an initiative measure to ensure the rational use of PPI. As part of our quality improvement and patient safety measures, reporting and analyzing near-miss prescription errors is of crucial importance to identify the safety threats and implement corrective measures. Proton pump inhibitor overuse was among these reports that has taken specific attention in our institution. PPI overuse in IP is actually a result of inappropriate stress ulcer prophylaxis or a failure to discontinue PPI prior to discharge. Therefore, we have conducted a study whose objective is to ensure the rational use of PPI by implementing policies and initiating stewardship. Two studies were conducted. The first one is an observational, cross-sectional, retrospective study to analyze the prescription indication of PPI use in IP ward. Then we have implemented PPI policies and guidelines, and we conducted the prospective studies to assess the implementation of these guidelines. All patients who were 18 years old and above were included in the criteria, and patients who were below 18 years and whose clinical data did not meet the criteria were excluded. Clinical data were collected from the patient's electronic medical record, revised and recorded in Excel sheet, and approved indication was provided from NHS guidelines and correct dosage from BNF and Lexicomp. In the retrospective study, 181 patients met the inclusion criteria. Here we have first compared the use of PPI to H2 blocker, and it was found that more PPI was prescribed at time of admission and discharge in comparison to very low percentage of H2 blocker prescription. PPI indication was mentioned in this graph, number 2, where it has shown different areas where the PPI was prescribed, like in gastritis, bariatric surgery, for NSAID prophylaxis, for surgery, prior to surgery, or for prescription with no indication or a risk factor. So, since we have found in that graph that there are some areas where PPI was prescribed with no indication, we have conducted an analysis to see the inadequate prescription of PPI. Inadequate means that either the PPI was prescribed with no indication or it is prescribed with indication but with wrong dosage. The results showed a very high percentage of PPI prescription inadequately at time of admission with 73.9%, and 51.9% of PPI were prescribed inadequately at time of discharge. So we have implemented guidelines for PPI usage, including approved PPI indication and advisory on when to initiate PPI for NSAID prophylaxis. Then these PPI guidelines were enforced by conducting meetings and training sessions to doctors. Prospective study was then conducted and 129 patients met the inclusion criteria. Data of both studies have been compared and the improvement is mentioned as follows. For the percentage of PPI prescribed as per the indication guidelines at time of admission, an obvious improvement has been seen from 42.3% to 52.3%. And for the percentage of PPI prescribed as per the correct dosage at time of admission also has improved from 61.7 to 93%. And this was a great achievement because PPI dose of 40 mg/d was stopped or it was limited to a stat or OD frequency. And this was a great achievement. At time of discharge also, there was a good improvement in the percentage of NSAID who was prescribed without adding a PPI prophylaxis in the absence of risk factor from 20.4% to 41% prescription. This indicated more physician awareness to stop prescription of PPI when it is not necessary. As a conclusion, the retrospective study has showed an obvious inappropriate prescription and overuse of PPI. However, with the implementation of PPI guidelines and policies, the PPI overuse has reduced, the PPI prescription as per the correct indication and dosage has increased, and the PPI prescription for NSAID prophylaxis without risk factor has also reduced. So these are good improvements that if we need to continue, An initiation of stewardship is an important factor in order to ensure the adherence to this PPI policy. Thank you.